Welcome back to the Better Health Now podcast. Today I'm sitting down with Dr. Victoria Clay, interventional pain management physician here at Cullman Regional. Thank you so much for being here.
Thank you for having me.
Of course. So before we kind of dive into this topic of interventional pain management, I want to talk a little bit about your background. So I know you're originally from the Cullman area. What ultimately led you to pursue the field of medicine, and kind of what brought you back to Cullman?
So I kind of knew from an early age that I wanted to be a physician. No one in my family is a physician or really in the medical field, but we had some really good family friends who were, and so I shadowed them and fell in love with helping patients and being in that field. I fell in love first with anesthesia.
Okay.
And that kind of brought me into the pain world. Anesthesia is, as you know, you meet a patient and you might not ever see them again. So I kind of missed having that longitudinal relationship with patients. And so that's how I specialized into the field of pain.
So is there certain pains that are more traditionally used with interventional pain management than others? And kind of what would be the typical things that you see that you're kind of able to use this method of pain management on for the patients?
So a lot of times we treat spine.
Okay.
A lot of patients have back pain. It's probably the number one cause of pain in the country. Number one cause of disability as well. So a lot of people have problems with their backs. So I would say probably 70% of patients that I treat have some sort of back pain, whether that's neck pain, low back pain. We treat a lot of spine, but that's not all we do. We treat also joint as well. So typically large joints, shoulders, knees, hips, things like that. But there's all kinds of pain conditions. So if someone has pain, I'm happy to see them and at least get them into the right area.
Yeah.
But we treat much more than just spine.
So what does the sort of the approach look like for the patient as they come in, and what is their experience like from that first consultation to maybe having that first procedure to then actually finding relief?
Yeah. So when you come to my office, the first thing, you'll meet our front staff. They're great. They can always help you and point you in the right direction. A lot of times patients get to our office either by self-referral, but they can also get referred by other physicians as well. If they're referred by other physicians, then I have their note, I've seen their imaging. So when I meet you for the first time, I have a good idea of what's going on. But I'll talk with you in the consultation room, and we'll come up with a plan to hopefully treat your pain. Typically, maybe with some medication, but typically with interventional approaches to try to treat that pain more targetedly. Once we come up with a plan, we'll either schedule you for an injection or schedule you for maybe something a little bit more conservative, like physical therapy or something like that.
So when people have the injections, that maybe is the direction that you recommend for them, is it sort of a one injection and they're done? Is it a series of injections, or does it just depend on necessarily the severity of the pain they're having?
Yeah. So a lot of times we do one injection and see how the patient responds. If the patient responds very well, then we can always repeat an injection in the future. We just have to wait a certain amount of time to make sure that that's appropriate for them and we're not causing other side effects.
Okay.
So, but people can have repeat injections, and a lot of patients do really well with that management plan. It just kind of depends on what you have going on, how long it's been there. But we'll go over all of that once you see me in clinic for the first time.
And I would assume that, like, if some of the injections don't necessarily work at the same rate that that either you're looking for the patient or the patient's expecting to see, then I guess is surgery that next option that you kind of push them to, or how do you kind of teeter-totter between, hey, maybe another injection, or let's try this instead, to like, hey, let's actually have surgery?
Yeah. So again, it really depends on the patient and what they have going on. A lot of people who come to see me have multiple problems. So they may have nerve-related pain, but they may also have arthritic-related pain. And those two things are treated very differently. So maybe if something doesn't work, we might try treating the other type of pain to see if we get better relief with that. So surgery isn't always the next option. It can be helpful to get a surgical opinion. But some patients don't want to have surgery, and that's okay too. We just manage them the best we can.
Yeah. So if someone's listening or watching this and they want to, take that next step to kind of have pain relief, and they're wanting to either come in and meet with you or kind of get the referral, what do you think is the best first step for them that are listening?
I think just to call our office. Like I said, people come by referral from other physicians, but we also take self-referral too. So if you think that you have a painful condition that could be treated with interventional approaches, I'm happy to sit down with you and kind of come up with a plan, whether that be interventional techniques or maybe more conservative techniques to start out. But I'm happy to have that conversation and at least lead you in the right direction.
Yeah. Well, I appreciate you taking the last little bit, talking a little bit about what interventional pain management is. I think it's something that I really wasn't aware that it was a way that physicians are now kind of treating pain. And I think the audience and everyone listening will have enjoyed kind of learning a little bit more about it. We'll have links to everything in the episode notes. So if anyone wants to find out more information or contact Cullman Regional Hospital, they can definitely find all the information there. But I appreciate you taking the time to talk with me.
Thank you so much for having me.
Of course.
I appreciate it.